This video is going to be of the palpation of the scapula. So we are starting our person in a prone position here. We have a pillow underneath just to kind of lift up the scapula a little bit, but we're going to try to identify all of its borders and edges to begin, and then we'll start landmarking things as we go. With your person on the table, if their scapula is kind of in a relaxed position, you might be able to kind of feel right away and find some of those edges. But this is sometimes a helpful hint if the person's able to. So what I'm going to do is I'm going to take her arm and I'm going to place it into the small of her back. Now, if she holds it up here for a second, it actually tightens up all the musculature, which is what we don't want. But if they're able to relax and let go, and you'll be able to see that from that elbow kind of dropping to the side, now the inferior angle tends to stick up a little bit easier. So this might make it easier to find it, but I don't actually like leaving the person's hand in this position for the majority of my palpation. So I'm actually going to bring it back. It's just helpful to get that first kind of step on where is it. Now myself, I like to go to the top of the shoulder here. I'm actually going to just cup. So thinking that this is the ball and socket, I'm just going to cup it and lift it up on that humerus in the front. And therefore I can kind of lift up that scapula. And now you can see all kind of the edges with just that passive retraction. So pretty easy to find this bottom kind of corner here, and then all the way along this border right here. So let's start naming some of those items. This is what's known as the inferior angle of the scapula. And I'm running my fingers currently all the way along up the medial border, sometimes referred to as the vertebral border, obviously because it's the one facing the vertebrae, but we're just going to call it medial border for the most part. And that goes all the way up, a little bit trickier to find from a prone, but we will find this in supine as well. You have to really sink through the trapezius or even hook in from the front of the trapezius, and up in here is the superior angle. So I prefer to find this from a supine, so stay tuned for later in the video and we will show you this from a supine view. So all along our medial border, inferior angle, and now I'm going to go and gently kind of push in and follow up along the lateral border. This whole lateral border is muscle attachment, so it might not feel quite as nice to kind of palpate along its edge, especially because two of the muscles attaching here are very ropey, and that is teres major and teres minor. But from around here to here, this would be our lateral border of the scapula. Now, because it is a triangular shaped bone, oftentimes people will call this whole kind of superior surface the superior border, but it actually has quite a bit of bumps and kind of divots in it. So just as a general, it's not an easy to follow your hand all the way along it. Okay, so now that we've kind of outlined some borders and angles, the next item I'm going to find is really easy, and this is the spine of the scapula, but the spine has quite a few things attached kind of to it and around it. And so we need to know where that is to be able to label other structures. A really easy way to do this is to take the palm of your hand and kind of feel the superior aspect of the shoulder. And within a short period of time, you should be able to identify kind of where the spine is right in here. All right, so finding the spine of the scapula, again, it's right along the top of the shoulder as I'm going back and forth across this here. And now I'm going to start to point out a few things. So if I can find the medial border of her scapula right here, and this is the spine, as the spine meets the medial border right in this location, this is actually known as the root of the spine of the scapula. So if you can think of kind of like the roots of a tree as the beginning, it actually goes and widens out a little bit as it meets that medial border. So we will have muscular attachment right into kind of the root aspect here as your rhomboid muscles are attaching. Rhomboid minor, typically in and around that root, with major below and left scap above. But once we found the root, I'm going to have a finger on the upper and lower portion of that spine, and as I work myself lateral, there is a thickening part which is known as a tubercle. So right in here is the tubercle of the spine of the scapula, and this is going to be an anchoring point for your lower trapezius as well as a little bit of your deltoid. So it often kind of has almost a little indentation or a divot, so you can kind of faintly see that on her body right here, and that is the lower part of her trapezius coming up from the low T-spine up and attaching in this location. So this is the tubercle of the spine of the scapula. As I travel laterally along the spine, I get to a nice sharp edge right here. And for people, almost doesn't matter the amount of muscle tissue or adipose or anything, this typically sticks out quite a bit, or it's easy to feel. And this is known as our acromial angle. So I can actually put my finger almost right underneath and kind of really poke it out. So this is a directional change from when the spine heading lateral turns and starts heading forward in what is known as the acromion process. So this would kind of be the posterior border of the acromion, and these fingers are on the lateral side of this acromion process. And then if I gently kind of scoop around towards the front, here is the anterior part. So I'll try to get fingers on all sides of it. So we have posterior, we have lateral, and I have anterior aspect of her acromion process. Okay, so finding the spine of the scapula will also help us to find the two fossas above and below that. So I'm going to first start by placing multi-fingers, could be one hand or two, and I want to make sure trapezius is really relaxed. So if it feels like there's a lot of tension, you might passively lift the shoulder or scapula up a little bit. So now that I have it a little bit more relaxed, easy for me to sink through, I'm going to go on the spine of the scapula. I'm going to roll my fingertips into what is known as the supraspinous fossa. So I'm sinking in. This is the origin of the muscle known as supraspinatus, and supraspinatus does abduction. So once I've located kind of what I believe is that muscle, I can take my other hand, go to the outside of their arm and ask them to gently push out into abduction, and relax. And let's do that one more time. Nice and gently push out. Perfect. So instead of activating the traps, which are a elevator upward rotator, we just want the beginning of that abduction to tighten up supraspinatus deep to trapezius without having it get too tense. So supraspinous fossa above the spine fossa, and then I'm going to drop below. I'll map out the inferior angle and the spine here, and so everything kind of in this area is known as the infraspinous fossa. This is going to be the origin for infraspinatus. So you have a large, flat, broad origin, multiple strands coming off of this muscle as it heads in this direction. So I am going to activate infraspinatus to help prove that I'm in the correct location. But for that, it's a rotator cuff. So I'm actually going to take her arm and I'm just going to gently hang it off the table here. So we are seeing that the borders have kind of changed a little bit since the scapula started to go into an upward rotation. But here is that inferior angle and here is that spine. So right in this location, I'm going to place my hand in the main part of the belly, and then I'm going to reach down towards her wrist as she's going to push up into me. So you can actually quite easily see. Let's relax your arm for a second. So I can kind of push in here. You can see some of my kind of pressure sink. And then as she externally rotates, that tightens up quite a bit as infraspinatus is pushing up in this area. Okay, and relax. All right, I'm going to return your arm back to your side. We're going to find one more landmark now, and this is one of the attachments for triceps. So I'm going to go back to my lateral border. The lower part or inferior part of it is going to be for teres major. And then as I go up, the superior lateral border is for teres minor. But right at the very top aspect of it is going to be the infraglenoid tubercle, which is the origin of the long head of triceps. So we can bring the arm, again, just hanging off the edge of the table. I'm going to ask her to lock her elbow into extension, and then she can relax that. I'm going to go back to that, what I believe is infraglenoid tubercle, and I'm going to push out against that. Perfect. And relax. So I can follow up this long head tendon as it goes up underneath teres minor into our infraglenoid tubercle right in here. We're going to be palpating the superior angle of the scapula. So I'm just going to trace out a triangle that I like people to go and kind of search for. So we have the clavicle as one of this anterior part of the triangle. We have the border of upper trapezius as kind of that posterior aspect, and then just simply the lateral side of the neck. So in this triangle, there's quite a few muscles and different things, structures to find, but I'm going to be going towards the most posterior kind of aspect of the neck, meeting trapezius, and I'm going to sink around a little bit and see if I can find a bony object that's sticking up. Now I have landmarked it. It's right here underneath this fingertip, but for a lot of people, especially if the trapezius is too tight or the scapulas are actually retracted, they might be even closer towards the neck. Another way to find this landmark is to reach underneath and lift it up. And what I mean by that is I'm actually going to go underneath her body and cup the inferior angle of the scapula and draw it up towards me, which will then ultimately raise that superior angle closer to myself. So try not to help me too much. But I'm going to reach across. I'm going to grab the shoulder. I'm going to reach underneath. Here is her inferior angle right here. So I'm essentially going to be doing this with my fingertips and pulling it up towards myself. We're going to relax the body back onto the hand. I'm going to come back up to the front here. I'm going to palpate in this area. I believe I found that landmark again. And then using that finger movement, I'm going to be pulling and lifting. So I'm actually quite easily, you can see my fingertip raising up and down as I'm lifting that scapula. So this movement with my fingers, and right here is our superior angle. Please take caution that individuals are typically tender or sensitive on the superior angle, since this is the insertion of levator scapula. Some references will say directly on it, and some will say just to the superior medial border of it. But either way, lev scap is often a muscle that holds a lot of tension in it. So if you're pushing and kind of digging around for it, we have a lot of sensitive structures from arteries and nerves in the side of the neck to, again, just an angry levator scapula. So I'm going to palpate into the side of her neck and feel for this ropey band right here being lev scap, and then its insertion right here on that bony object. And one more confirmation is to ask her to try and raise that shoulder up towards her ear. Perfect. And relax. That got quite tight as she did that. We'll try that one more time. Good. And back down. So that's going to be our attachment for lev scap as she does elevation of that scapulothoracic joint. All right, in supine, we're going to be finding 3 landmarks of the scapula. So the first one I'm going to be looking for here is the coracoid process. We're going to be kind of landmarking a few things of the humerus as well as of the clavicle to help us be in the right location, as well as I'm going to fire off a couple muscles. So on often kind of, I would say, guesswork is that people go inferior clavicle and poke around in this area looking for the coracoid process, but they're actually missing the fact that the coracoid is very anterior. It is inferior to the clavicle, but it actually sticks out more anterior than the lateral clavicle. So what I like to do is I actually get my client involved a little bit here. I'm going to ask her to hold her own arm up in the air, and I can easily start to identify the anterior and more medial border of this deltoid. So anterior deltoid, the medial border. And if I had her start to bring her arm across her chest for me, this would be pectoralis major. So there's actually a part of the clavicle that doesn't have either of those 2 muscles attached to it, which often leaves kind of this triangular soft spot right here. This is not the location to find the coracoid process, but this is where people often dig and look for it. It's actually just lateral to this. So if I'm in this soft spot, I can push around, I feel some soft tissue, I feel some pectoralis major, but as I head lateral, using that same palp pressure, all of a sudden I can't sink in at all, and I feel what we often call like a gumball or a knuckle underneath the surface. This is the coracoid process right here. So I have 3 fingers kind of circling it right now. I'm going to take one finger and go around in a full circle. So here's the inferior part of it. There's the lateral aspect of it. Here's the superior, and then back around to the medial. So we have the clavicle here in that concave aspect of it. Here is her acromioclavicular joint versus the coracoid. So again, you can see that the AC joint's actually more lateral and superior than that coracoid, but lateral to it's going to be the humerus. So I'm going to take her arm, bring it out. We're actually kind of in a neutral position anatomically. I'm going to palpate the front of that, do a little internal and external rotation, and I'm feeling for her long head biceps tendon. As I go medial to that, I have the lesser tubercle of the humerus, and if I go a little bit farther medial, I end up on that coracoid process. So if we watch really carefully here, I don't know how easily you'll be able to pick it up on camera. However, if I do medial and lateral rotation, this part of the bony structure is actually moving underneath the surface, and this part between my fingers is not. The coracoid process is a part of the scapula, and I'm currently medially and laterally rotating her humerus. So the coracoid process should not move. Now we are going to list off a couple muscles to help us prove the coracoid. There's 3 muscles utilizing it as an attachment. So just inferior and heading down towards ribs 3, 4, and 5. So we're pushing just above kind of breast tissue here in the pec. If you're able to just almost push your shoulder forward towards my hand for me a little bit, excellent. Here is pectoralis minor through pec major, and that's attaching to the coracoid process. Or we could activate 2 muscles going down in the arm. So I'm having her in a supinated position. She's going to do a gentle pull, and right in there, we have the biceps short head and relax. And if you started to lift your arm up a little bit, that would also fire off that biceps short head and coracobrachialis. So you can use any one of those kind of 3 muscles to help you orient this coracoid process. But I'm now actually going to go for it underneath pectoralis major. So for this, we need some consent from our body that she's okay with me going into her axilla. And I'm going to bring the arm out a little bit. So you're looking for the lateral kind of inferior edge of pectoralis major here. And I'm going to be placing a couple fingertips into this location, but I want pec in a slackened state, not in a taut state. So as I have the arm out to the side, which would create lots of space in the armpit, it's actually lengthening pectoralis major. So if I tried to push up underneath, I'm going to feel a lot of resistance from pectoralis major, and this will not be helpful for me to try to get all the way up to this coracoid process. So what I'm actually going to do is find that kind of border, and then I'm going to take away the camera's view for a second of where my fingertips are. I'm going to bring her arm across her body, and my fingers are still in the same location, and I'm going to try to go up here. So we might make a little camera magic happen here as I'm sinking in, and now as I push up, my fingers are lifting up from below my hands that are on the outer surface. So I'm feeling the coracoid process from this hand inside the axilla, and as I push into it, it's lifting up my upper fingertips here. So you can actually see that I'm down as far as the coracoid. Now, one thing I am going to have to mention that when you're inside this axilla, you will not feel that same ball-like structure at this point, but it will just feel like a bony object inside this axilla. A couple ways that I can prove it. I'm actually preferring to use a pec minor at the moment. So I'm going to have her just start to push her elbow up towards the ceiling. Good. This is a serratus anterior, but it also does work a little bit for pectoralis minor. If you want more pec, you kind of angle the elbow down. Perfect. And I'm getting a nice kind of ropey musculature coming in from below. If again, draping wise, if you wanted a little bit more security on the lateral edge of breast tissue, you could also ask your client to reach over and just basically create a border or cup the edge of breast tissue and kind of move that out of the way, which will help you kind of access. Perfect. So getting up and being able to kind of strum pec minor and then follow it up towards that coracoid process. We will use this same style palpation when we follow biceps and coracobrachialis up towards that bony attachment there. So I'll bring your arm back down. Thank you very much. Okay, so that is both coracoid process over top of and through, as well as underneath pectoralis major and kind of up through the axilla. All right, we're going to be palpating the subscapular fossa. So I have kind of changed the draping a little bit here, and what we've done is just created a lateral line, which is going to give me a little bit more access to the axilla instead of our sheet kind of going straight down and getting tucked underneath the scapula. So this is giving me more access to the axilla and then trying to get deeper down towards that subscapular fossa. Honestly, the best place to go in is kind of picturing the deepest part of the fossa. So if you push in too high here or superior, you're going to get into pectoralis major. And if you push towards the bottom, you're going to hit the lateral side of the scapula with either lats or teres major minor. So we're really going to go right into the deepest location of it. I'm going to place a couple fingertips in here. Now, the next error that people make is that if you push up, this is following the ribs into serratus up towards pec minor, and I kind of want to go down towards the table with my pressure. So again, control of the wrist, open the space up. Now what we're going to do is the view is going to go away a little bit as I place her hand onto her abdomen. And with my other hand, what I'm going to do is I'm going to reach underneath the scapula, grab the medial inferior border of it, and I'm going to wing it out towards me. I like to call this opening the drawer, as you kind of reach underneath, grab it, and then pull the drawer towards you, and the drawer being the scapula in this case. So I'm just going to lift up her shoulder, kind of in here. I'm going to reach underneath, find that medial border. I'm hooking my fingertips onto it right there. And then we're going to relax the hand all the way down. And so what this does is I can actually bring that scapula out towards me. So I'll show this a couple times. Might be a little bit tricky to see, but I'll point out that this right here is her inferior angle of the scapula. So that is the scapula fully kind of rotated. Technically, there's some upward rotation. So now this outer musculature right in here is lats and teres. Get a nice roll of teres major right there. However, I'm going to go kind of past teres up into our subscapular fossa and place my hand down on it. Okay, now that we're inside this space, we can close the arm up. You guys have seen where my hands are. And what I'm going to ask my partner to do here is to push her palm down into her belly. Good. So I'm just going to take my other hand out for a second just to show clarity. What she's doing correct, but what we don't want from your person is to do this. And what we want for them to do is this. So subscapularis is one of your rotator cuff muscles, and it's responsible for medial or internal rotation. So to find the subscapular fossa, you're wanting to find basically the subscapularis muscle. So there should be a little bit of a view. She pushes down on that, and my fingertips are getting raised up and down as I'm inside that subscapular fossa. Let's do that a couple more times. Good. Great. So you can see my fingers going up and down a few times. So this is the subscapular fossa, and we've proved it with the muscle subscapularis. To come out of that, again, a reversal, I'm going to gently decrease my pressure on the inside hand here, slide that out nice and gently, and then close the space back up for them.